A transitional plan of care is used for young adults with special health care needs.
When I work with parents and the children or young adults, it's a transitional plan of care. It works well for us and the parent or adult because it has all the information, their doctor's names, phone numbers, addresses, as well as a treatment plan. What are we going to work on with your healthcare goals at this time? What kind of information do you need, and what kind of planning do you need for your transition?
But a lot of the groundwork is about shifting the responsibility, the thinking, the decision-making to the youth so that he or she is ready to make decisions and to really know what their health care is about.
The plan of care is also used for a tool to provide case coordination with other agencies. Is it Department of Human Services, the Medicaid worker, chore provider worker? Also, are there community mental health, are they involved? And if they are involved, what types of transition planning are they doing? And what is their diagnosis, which is so important to have?
I think it behooves kids and parents, families, if the pediatrician doesn't bring it up, to bring it up and start talking about it. And starting the conversation does not mean the end of the relationship with the pediatrician. I mean, that's one of the things I found when I bring it up. People sometimes want to close the conversation because they're afraid if we talk about it, that means they have to change doctors. And that doesn't mean they have to change doctors right away. It just means let's start to plan this. It might be something that we want to make a change in 3 years or 4 years or 6 years or maybe in 3 months. But let's start to plan it so that it isn't an abrupt, suddenly you're without a doctor, you don't know where to turn, you can't get your medicines.
Sometimes the young adult doesn't have all the information, or maybe they're used to the parents handling some things. And sometimes the young adult does it themselves, which is great. And then just having the parent encourage the child all along to, okay, well, maybe now you can make your appointment, or maybe you can call in the prescription, and just giving them some extra responsibility as they go along, whatever they're able to do.
A friend of my mom's gave me just a little booklet that had blank pages in it with lines. And from that day on, and I didn't do it personal. I just kept it as a medical journal. When your medical journal gets to be this long, those doctors that come in, they can't read every single thing. And if you have that and they ask you questions, you can flip back to it.
Okay. Basically, up until I was 18, all my health care issues I really had my mom handle. Then fate kind of intervened, and she got a job working during the day when most of the specialists would call and everything. So I'd have to pull out my record and look at it. And then logic clicked in. I was like, I might as well read this, seeing as it's my body. And
you, for example, may want to look at your medical records, or may want to look at your educational records. Well, you have the right to do that, just like anybody else does. There are a couple of laws that give you the right to do that.
What's called the Health Insurance Portability and Accountability Act, or HIPAA,
gives you the right not only to look at your medical records, but it also protects those records from other people looking at them unless you give permission.
Think about having permission to have the youth giving permission to providers for the parents to be involved in their care. Release of information. An example, 19-year-old is away from home, gets in an automobile accident or something happens, is in an emergency department. The doctors there cannot reveal information to the youth's parents without the explicit written permission.
Healthcare.
Pediatric specialists are specialists in children and youth, and we do not have the training or the years of experience taking care of adults or grown-ups that a family physician or an adult provider has. And so there comes a time when we're just not the best doctor to provide for the individual's needs. So that's why we need to make the transition.
When you go to the doctor, having questions on a list, a piece of paper that you might have maybe about your diagnosis if it's early on, or possibly your medication, or whatever questions you have about your treatment plan. And once you get to the doctor, if the doctor says something that you don't understand, to ask questions there about medications, whatever it may be. So advocating for yourself.
Shantina is aware of her needs, her medical needs. She knows who her physicians are. She knows where her supplies come from, her other assistant devices. She knows where it's come from. But as for actually coordinating her appointments and making sure things are followed through is either myself or my mother.
We did start when she was 12, having her take her own medication, and much of the time she orders her own medication. She does make her own doctor's appointments.
Insurance, which is a major thing with healthcare. What type of insurance do you have? Do you have private insurance? And if you do, under what? Is it under your parents, or is it under your employer?
Looking to what's available if the youth is going to be in an educational setting. There may be health insurance they can buy through the educational setting. There may be, if they're in a community college, the community colleges don't offer their own plans, but if the young person is studying, they'll be eligible for a plan. There are some plans that are reasonable in their expense.
If you don't have insurance, I'd find out your university normally has a health clinic where you can pay by visit, or they'll charge it to your student account, or you can go to urgent care if you get a cold or the flu or something and you need medicine.
And there are also some resources at the state and at the county level through their local health department. There's some folks that can sit down and say, here are the options and how can we make this work, and let's see if we can find something. That's not to say that you can always find a solution, but with being well informed opens the options. You can know what the options are and see what you can arrange. The big message here is to think ahead, have a plan, and have a relationship, relationship with a practice, whether it's your pediatric practice or a family practice or an internal medicine practice. Start early in the individual, knowing what their healthcare issues are, what their needs are, what their medicines are about, if they have medicines. If they are not on medicines and don't have a health condition, to know themselves what are their immunizations, what are their immunization needs, what do they need to do. Have them begin to assume the responsibility for their health earlier rather than later.